practitioner today. How are you feeling?
Good.
Okay, we are going to be performing an assessment of your abdominal, musculoskeletal, and neurological system.
Okay.
Do you have any questions before we start?
Nope.
Okay, well, let me wash my hands and then we'll start. I'm going to start with your abdominal examination, so I'm going to ask you to lay flat. And I'm going to start by inspecting your abdomen. I'm going to leave your shirt on for privacy reasons, but I'm going to be inspecting for any redness, lesions, rashes, bruises, anything like that. I see pulsations of your aorta. Okay, and the contour of your stomach looks good. Okay. Next, I'm going to move on to auscultation. I'm going to be auscultating in all four quadrants of your abdomen. Okay, I'm going to start with your right upper quadrant, left upper quadrant, left lower quadrant, and right lower quadrant. Vowel sounds are normal, active, and present in all four quadrants. Now I'm going to be listening over your the arteries of your stomach. I'm going to start with the diaphragm of a stethoscope in your aorta. I'm going to use the bell. No bruise noted, and I'm going to move on to your renal arteries. Use the bell. Use the bell. Now your iliac. Use the bell. Use the bell. And your femoral. Using the bell of my stethoscope. And moving on to the bell of my stethoscope. Okay, no bruise noted. Next, we're going to move on to percussion. So I'm going to be percussing over your abdomen, okay? Okay, now sounds are tympanic sounds heard throughout, some areas of dullness, but that's normal. And then next, I'm going to be percussing for the length of your liver. So I'm going to start at your umbilicus and move upward until I hear dullness. Okay, dullness is heard right here. Now I'm going to move down. Okay, dullness is heard. And I marked both spots, so I'm going to measure it. And about 5 centimeters. Okay, great, that's normal. Next, I'm going to move on to palpation. I'm going to start with light palpation and then perform deep palpation. Okay?
Okay.
Okay. Let me know if you feel any tenderness, if I'm hurting you. No? Okay, now I'm going to move on to deep palpation. I'm feeling for any masses or any enlarged organs. Any pain?
Nope.
Okay, and now I'm going to be palpating your spleen. So I'm going to ask you to lay on your side. I'm going to put my hand here, and I'm going to palpate below your rib cage to try to feel for your spleen. Normally, your spleen can't be felt, so only if it's enlarged, I'll be able to feel it. And I don't. And that's great, so that's normal. Next, I'm going to be testing for CVA tenderness. Can you sit up for me, please? Actually, could you sit?
It's better than kind of.
Yeah, okay, I'm going to put my hand over and then testing for tenderness. Any tenderness?
Nope.
Okay, great. Do you have any questions? Okay, so that completes the abdominal portion of our exam, and now we're going to move on to the musculoskeletal. So I'm going to start by inspecting your neck. Can you put your hair up for me? Looking for any redness, skin lesions, anything like that. None noted. Gonna palpate any tenderness.
Nope.
Okay, and now I'm going to ask you to flex your neck. Can you touch your chin to your chest? Now extend, put your head up, and then move your foot from side to side. Okay, now I'm going to be testing strength. Can you push up against my hand? Okay, good. Okay, 5+ strength noted. And I'm performing passive range of motion. And can you move your neck on yourself to perform active range of motion. Okay, great. Any questions?
Nope.
Okay, next I'm gonna move on to your shoulder. I'm gonna leave your shirt on for privacy reasons, but I'm inspecting your shoulder. No redness noted, no skin lesions, no bruising or scarring noted. I'm gonna palpate. Any tenderness?
Nope.
No. Okay. And now we're gonna perform range of motion of your shoulder. So I'm gonna ask you to flex your shoulders, so put your arm up. Now extend, put your arm back. Now we're gonna abduct, move your arm up above your head, that, and adduct, move your arm across your body. Now we're gonna do internal rotation, move your arm behind your back, and external rotation, with your head above your, to your back like that. Okay, great. Do you have any pain doing any of that?
Nope.
And now I'm gonna be testing your strength. Can you push up against my hands? Okay, great. 5+ strength noted. Next, we're going to be moving on to your elbow. So please put your arm out for me, please. I'm going to be inspecting your elbow. No redness noted. Skin lesions, bruising. Colors and consistent with ethnicity. Now I'm going to palpate. Okay, and now I'm going to ask you to extend your elbow and now flex your elbow. And then I am going to perform strength. Can you push up against my hand? Okay, 5+ strength. And then can you move your hands like this? Okay, great. I'm going to perform passive range of motion of your elbow. And then I'm going to have you perform active range of motion of your elbow. And I forgot to do it on your shoulder, so I'm going to perform passive range of motion on your shoulder. And then I'm going to have you move your shoulder by yourself. Okay, great. So we're going to skip the hips and the back for now, or your spine. I'm going to move on to the knees, and then we'll do that at the end. So I'm going to look at your knees, inspecting your knees. Some old scarring noted, but no redness, open wounds, swelling, none of that. I'm going to palpate right above the patella. Okay, any pain?
Nope.
Okay, and your knees. Yeah, could you just lift your knee a little bit? Could you extend your knee? And then flex it. Okay, good. And then I'm gonna put your knee up a little bit and then push up against my resistance. Okay, 5+ strength noted. Or actually, let's do it again. Push up. Okay, good. 5+ strength noted. And now we're gonna move on to your ankle. So I'm gonna inspect your ankle. No redness, swelling noted, no open wounds. Oh, let me adjust the camera so we can see your feet. Okay. Now I'm gonna palpate. Any tenderness?
Nope.
Okay. And now I'm gonna ask you to plantar flex your foot. Now dorsiflex, point your toes up. And then we're gonna perform inversion and eversion. Okay, great. And then I'm gonna, can you take my hand and can you push up against my hand? Okay, 5+ strength. Great. Any questions?
Nope.
Okay, now we're gonna move on. Oh, we have to do active and passive range of motion for your knee and for your ankle. Can you move your ankle around? And then I'm gonna move it around for passive range of motion. And then are you able to move your knee? Okay, and I'm gonna move it. Okay, great. Now we're gonna do your hips and then your spine. So can you lay flat for me and I'll start with your hips? Okay, and I'm gonna move this back up. So I'm gonna start by inspecting your hips, leaving your clothes on for privacy. But no redness noted, erythema, swelling, skin looks intact. Now I'm gonna palpate your hips. Any pain when I palpate?
Nope.
Okay, great. Now I'm gonna be performing range of motion of your hip. Can you lift your leg up for me to flex? Okay, now I'm gonna take your knee, bend your knee, and I'm gonna perform internal rotation and external rotation. And put your leg flat. And now abduct your abduct your hip. Okay, great. I'm going to perform strength test. Could you lift your leg up? Or, sorry, lift your leg up. And then lift your leg up and then push up against my hands. Okay, 5 plus strength noted. And then lastly, we're going to extend your hip. So could you lay flat on your stomach? And then lift your leg up. Okay, extension looks good. Okay, great. Now if you can stand, inspect your spine. You can stand right here. They're tall, so we're gonna move this up. Okay, if you can come right here. I'm gonna leave your clothes on for privacy, but I'm inspecting your spine. No erythema, swelling, redness noted. Let me palpate. Any pain?
No.
Okay, now I'm going to ask you to flex your spine. Could you bend forward and extend, bend back, and then move. I'm going to test lateral side to side, so one side and then the other, and then we're going to rotate your spine. Any pain when you do that?
Nope.
Okay, now I'm going to perform passive range of motion. So I'm going to move your spine for you. Okay, good. Cool. Any questions?
Nope.
Okay, great. So that covers the musculoskeletal portion of the exam. Now we're going to move on to the neurological. If you can sit down. And let me adjust the camera again. So for the neurological portion of the exam, we're going to start by testing your mental status and higher functioning. So I'm going to start by asking you counting backwards by sevens from 100.
Okay.
So 100.
100, 93, 86, 79, 72, 65, 58, 51, 44.
That's good. Okay, good job. And now I'm going to test your high functioning. Can you name 5 major cities for me?
New York, Dallas, Portland, Seattle, San Francisco.
Okay, great. And can you tell me your favorite U.S. president?
Barack Obama.
Okay. Now I'm going to be testing your cranial nerves. I'm going to start with cranial nerve 1. So I'm going to have you smell this. Can you smell it?
Yeah.
Okay, cranial nerve 1 is intact. Now I'm going to be testing cranial nerve 2. We're going to be performing the cover uncover test. Could you just face me like at an angle a little bit? I'm going to cover one eye, and then tell me when you see something coming from the corner of your eye.
No.
Okay, let's do the other eye.
No.
Okay, cranial nerve 2 is intact. Next, we're going to be testing cranial nerve 3, testing for direct and consensual response. So we're testing cranial nerve 3 for direct and consensual response. I'm testing your eye pupils. Okay. Okay. Pupils are equal, round, and reactive to light. Cranial nerve 3 is intact. Next, we're going to be testing cranial nerves 4 and 6. It's using the 6 cardinal gaze test. So I'm going to be at your level, and don't move your head at all, and point to where I'm moving my finger, and just look with your eyes, okay? Okay, great. Cranial nerves 4 and then 6 are intact. Next, we're going to move on to cranial nerve 5. So I'm going to have you clench your jaw, testing for, to make sure that you're able to clench your jaw and testing for strength. Now can you push up against my hand? Push up against my hand this way. Okay, great. Cranial nerve 5 is intact. Next we're going to move on to cranial nerve 7, your facial nerve. Can you smile for me? Okay, great. Face is symmetric. Cranial nerve 7 is intact. Next we're going to move on to cranial nerve 8, and that is the acoustic nerve, and we're going to be performing the whisper test, okay? So I'm going to go behind you and put my finger over your tragus and whisper 3 things into your ear and tell me what they are. 1, 2, 3.
1, 2, 3.
Okay, we'll do the other ear.
ABC.
Okay, great. Cranial nerve 8 is intact. Next, we're going to be testing for cranial nerves 9 and 10. So I'm going to have you stick your tongue out. And actually, let me get the light. Okay. Stick your tongue out. Your soft palate arises, say ah. Soft palate arises, and you'll feel it is midline. I'm going to stick this in and let me turn the light off. Test your gag reflex. Okay. Great. Cranial nerves 9 and 10 are intact. Next, I'm going to be testing cranial nerve 11. I'm going to have you shrug against my hand. Okay. Now you let go, relax. Cranial nerve 11 is intact. And lastly, cranial nerve 12. I'm going to have you stick your tongue out, say ah, or just stick your tongue out. Tongue is symmetric. Cranial nerve 12 is intact. Okay, great. Do you have any questions?
Nope.
Okay, so now we're going to be testing your reflexes. I'm going to start with your bicep. So you put your arm out and try to relax your arm. Okay, like that. Okay, 2 plus reflex. Now your tricep. You can try to relax your arm. Okay, let's do it again. Okay, 2 plus reflex. I'm going to move on to your patella. Could you, I'm going to lower this. Okay, 2 plus. I'm going to move on to your Achilles. 2 plus. And now I'm going to be testing for your Babinski reflex. Lift your foot up and then move this with a J. Okay, no fanning of the toes noted. That's normal. And then clonus, can you lift your hand up against my hand? Okay. 2 plus, or your clonus is intact. Okay, so that completes the reflexes. Now we're going to move on to your cerebellar functioning. And I'm going to grab a cotton swab and I'm going to be asking you to close your eyes. Okay, this is soft and this is hard. Do you feel the difference?
Yep.
Okay, I'm going to be placing either the cotton swab or the reflex hammer and tell me what you're feeling. Okay, soft or hard?
Okay. Soft. Soft. Hard. Hard. Soft. Soft. Hard. Soft.
Okay, great. Your sensations are intact. Next, I'm going to put these down. And let's move this up a little bit. Okay, I'm going to test for coordination. So touch your finger to your nose. Both hands. Okay, coordination's intact. And then we're going to do the tandem gait. So I am going to have you okay, so I'm gonna have you come stand over here. Come closer to me. Okay, there you go, yeah. And then you're gonna do a heel to toe,
Okay.
like that. I'm just walking a straight line. Okay, coordination's intact. And I'm gonna have you just come back over here and just walk in a normal straight line. Test your gaze just towards the camera. Okay, you have a good gait. And then I forgot to do one last thing, the abdominal exam, so we're gonna do that and then we'll be done with the test, okay?
Cool.
Okay, so I'm gonna flip the camera back up. I'm gonna ask you to lay down. And I forgot to test the length of your abdominal aorta. So I'm gonna feel for pulsations. Okay. And now I'm gonna measure the length. here to here, 3 centimeters, and that is normal for a male. Okay, great. Do you have any questions before we end the exam?
Nope.
Okay, well, then let's just move this back up. Okay, well, you can just sit up.
Yep.
Okay. And if you don't have any other questions, we'll end the exam, okay?
Great.
Okay, great. Thank you.
Thank you.